welcome to Salubrious Skin with Dr. Irene. Today I'm talking about emotional traumas and the impact it has on our body at a cellular level, and how Chinese medicine looks to rectifying this trauma and the consequences of the altered state of health that happens as a result, and what Chinese medicine can actually do. Now, emotional trauma is very different for everyone. It might be a traumatic event someone goes through. It could be a chronic illness someone is experiencing, a death or a loss. It could even be, relationships. It actually can be genetic. So it could be trauma experience from, say, a parent, and that gets passed on through the genetic line. So the ways of rectifying trauma is quite unique for each person based on what they've experienced and based on their state of health. Now, emotional trauma in Chinese medicine is seen as a pathogen that causes a disharmony to the body. So you may, if you've experienced any Chinese medicine treatment, you may feel that we talk about pathogens a lot. You know, if you've got a cold, there's pathogens entering your body. If you have arthritis, pathogens are obstructing your circulation, causing the pain in the joints or the deformity that's happening in the joints. So in Chinese medicine, we see emotional trauma as a pathogen that creates disharmony. Now, the areas that are affected are the Jing, the Qi, and the Shen. Now, the Jing we call like your essence. It's what you acquire. It's your genetics that you acquire from your parents, but it's also your genetics that you have. And it's the material basis of the body, and it's the fluid essence of the body's life force. Now, Qi we know as energy. So without Qi, blood doesn't move, and Qi and blood work very closely hand in hand. So if one's deficient, the other one gets deficient. But in this circumstance, Qi is energy in the body. And finally, Shen. Shen is our conscious mind, our emotional body, and our thoughts. Now, there's 3 stages emotional trauma affects the body. Stage 1 is a traumatic event. Now, the initial trauma scatters the Qi and distresses what we call in Chinese medicine the earth element, which is the spleen, stomach, and it disturbs the Shen. So basically scatters the Qi, so the Qi is unable to do its job properly and just gets, unnecessarily dispersed and can upset the spleen, stomach, and also the Shen. The other thing that happens that's really interesting, and this is the reason why people don't necessarily remember aspects of the traumatic event. But what happens is the pericardium, which is the sheath around the heart, it actually tightens to protect the heart from the trauma. But what that actually does, it actually traps the trauma inside, and it makes it more difficult to release. But the most important thing is that people don't necessarily remember aspects of the traumatic event because of this. Then fear enters the body, and blockages of Jing, Qi, and blood occur. And after a period of time, this translates into heat and or cold, and damp and phlegm. Now, stage 2 is reliving the traumatic event in memory. So this is better known as post-traumatic stress disorder. And many traumatic situations, and this might be trauma continuing, such as in an abuse situation. So you have both elements there. You have stage 1 and stage 2 as well. And basically this stage generates wind and heat. So the emotions will intensify as a result of reliving these events, and the blockages then just get worse, because you're almost being re-traumatized when you're reliving the event. And then these blockages will disrupt the flow of chi and cause what we call rebellious chi. So the chi in the body, each organ does a certain type of movement or effect. So when we talk about the lungs, the lung chi disperses and descends. And when we say that's rebellious, it will ascend and cause coughing and things like that. Stomach chi goes down. When it's doing the wrong thing, it ascends and obviously causes reflux and heartburn and indigestion. So basically, the rebellious chi will manifest into something depending on what organ is mostly affected by it. Then unresolved trauma in the body is stage 3. So when the trauma hasn't actually been resolved, what happens is that the exacerbation of blockages, heat, wind, cold, phlegm, damp, all this sort of stuff starts to deplete the chi, blood, yin and yang. So what we see is whatever symptoms transpire as a result of the traumatic event, they just seem to exacerbate, because it really goes to a depleted state. So first we have what we call in Chinese medicine an excess state. So heat and cold, they're all excess situations. And over a period of time, because it starts to consume the body's resources, it becomes a deficient state of health. Now, it isn't uncommon for people when they come into my clinic to present with both, with heat and so with an excess situation and a deficient situation, especially when it's been a long-standing trauma that people haven't necessarily known how to deal with, or it transpires and manifests into something that affects different parts of the body. So what we need to do in Chinese medicine is understand how the trauma has impacted the body, what pathogens need to be dispersed, and what areas of the body are depleted. So we need to rejuvenate that. So we also take it in kind of like 3 steps. As the trauma happens, we also take it in 3 steps as well. So the first and most important thing is for us to kind of what we call gather the chi. So we kind of need to make the chi start working properly. We need to start making it move properly. And the way we identify where the rebellious chi is situated is through talking about your symptoms, recognizing any disease states, how is the disease manifested over a period of time, what organs are affected, is there heat, is there cold, is there phlegm, is there damp, any deficiencies. We look at the 5-element theory in Chinese medicine. We look at how all the organ systems are correlating with each other. How's the communication happening between those organ systems? Because if one organ is not working properly, that will upset another, and vice versa. So that 5-element theory that we focus on and understand the basis of the human body, we look at that and pinpoint where the issues are in that aspect. The other thing is we look at the face. The face tells us a lot. Any darkness under the eyes, any melasma, or any sort of dryness. We look at the tongue. That says a lot of which organs are affected. We feel the pulse. That also identifies various organ deficiencies. And we also do something called channel palpation, which means we just palpate along certain meridians that we feel are involved and see if there's any actual physical masses that have developed, because that's what happens after a long period of time. If someone has been traumatized from a young age and now they're in adulthood and they've never really delved into dealing with the physiological reactions that have occurred as a result of the trauma, these organ systems along the meridian will actually cause physical masses. So what we as practitioners will feel either a little bit of like a tissue buildup, or there could be discoloration on the skin where at a certain point There could be what we call, gosh, I've had a mental blank, but little bone developments where the bone has been built up. All that sort of thing really identifies what we need to rectify. So like I said, first thing, we gather the chi, we support the person's spleen and stomach, and we stabilize the shen, we stabilize the mind. Because what happens in these circumstances, the mind can be all over the place, sleep is affected, various emotions generate anxiety and all that sort of thing. So it's really important to stabilize the shen, calm the shen, and that will assist the next stages in treating the person. The other thing we do is regulate the pericardium. Like I said, at the first state of trauma is the pericardium tightens to protect the heart. That, like I said, the pericardium is the sheath around the heart, and it's always protecting its heart. That's its job. That's all it has to do. Even when physical things are in our bloodstream, it'll always impact the pericardium first, because it's protecting the heart from anything. Because without your heart working properly, there is no life. So, and we have the same sheaths in the brain as well. Excuse me. So as far as the heart's concerned, we need to regulate the pericardium to allow the release of trauma to happen. If we don't relax the pericardium, the trauma, like I said, stays trapped. And that's where the reliving happens. We need to relax the pericardium to allow the trauma to disperse and to go. And by releasing the blockages in the yin organs, so in the spleen, heart, liver, and lung, if we release the blockages in those organs, then we're on our way to healing the body from the trauma. Now, the second stage that we look at doing is soothe the traumatic memory. So once we've relaxed the pericardium and it's working a lot better, we're now able to soothe the traumatic memory. And by this, we mean we reduce the fire and the wind. We calm the shen by bringing down the yang organs. So yang can become very exuberant. Let me explain yang. So, if your child has ADD, let's just say, we call that exuberant yang. Yang is overreactive. It's almost like heightened. It's reaching its superficial level. What we need to do is calm yang. Boys particularly are yang in nature, but if they have exuberant yang, they get categorized as having ADD. So similarly, in a traumatic event, we need to, in treating a traumatic event, we need to soothe the trauma by bringing down the yang. And the organs associated with yang are the stomach, small intestine, large intestine, and gallbladder. Now, final stage in treating emotional traumas is treating the individual imbalances that have occurred. So obviously, based on our genetics, we have deficiencies, and so as a result, these deficiencies will allow the imbalance to happen in various organ systems. So if someone's prone to skin problems, or someone's prone to headaches, or another autoimmune disease like a GI tract issue, whatever the personal imbalances are, we need to restore that, because that's ultimately the goal of the person that comes in. People come in because of the individual imbalances. They don't necessarily come in because they've got the trauma, because what most people do is try and deal with the trauma, especially when it happens in a very young age. People, whether it's a personal belief or whether it's that of people around them, people believe they should have gotten over it by then. It's been 20 years, it's been 40 years, I should have gotten over it, but it's not that easy. Like I said, the trauma gets trapped by the pericardium protecting the heart. So it's not so easily forgotten. And if we just simply just say, well, just go on antidepressants and you'll be fine, you're not dealing with the trauma, you're not dealing with the problem. And when it comes a point of time where you feel, oh, okay, I want to come off the antidepressants, or perhaps, you know, I want to see how my body actually organically reacts, you have those manifestations of withdrawal happened. And then often in many circumstances, people go on and because they can't deal with the side effects associated from withdrawing from antidepressants. So very important to treat the individual imbalances. And these are, like I said, very unique to each person, and also unique to the result of the trauma. So each person is going to result in different effects, and also the age it happens and the type of thing that it is and all that sort of stuff. Now, once the chi is gathered, as we say, so once the chi is working really well and the impact of the trauma is reduced, the individual circumstances, the symptoms and signs can be dealt with. Now, let's just say we don't deal with the previous two steps. Let's just say, you know what, I think I've gotten over the trauma. I don't necessarily feel that it's something that's impacting me, but these headaches are driving me nuts. I really want you to focus on the headaches. What happens in that circumstance is people do get better, without a doubt, people do get better. But what happens is that then these symptoms reoccur because the basis of the trauma has not been dealt with. And, you know, I always believed, you know, it's really important to work through trauma and talk about it. But my question is now, is it necessary? Do I really necessarily have to relive everything again? You know, not necessarily me, but someone who goes through a traumatic event, let's just say someone who, you know, has been at war and has personally killed people and seen people kill their friends, do they need to relive that event? Or is there a way of allowing the body to heal without going back to that state of mind? Because, as I said, with stage 2 of emotional trauma, the reliving of the event actually causes more disruption. It causes what we said, the emotions to intensify and the blockages to increase. So it's not necessarily saying, okay, let's not deal with anything, but I think it's also about recognizing what the body has done to protect itself as a result of the trauma, and how we can come in as Chinese medicine practitioners to help resolve the physiological changes that have occurred. And this is just a different way of looking at things. I have had patients where they've done many years of counselling and don't necessarily feel like they've moved on because there's been no change to their physiological state of health. Or what counselling does is discuss the situation, perhaps gives you coping mechanisms, allows you to process the situation that has transpired in whatever way the therapist sees fit. And in some circumstances, people are on medications. But none of this is actually changing the physiological reaction to the trauma. So I don't necessarily think people shouldn't do counselling. That's more of an individual decision. But if you do decide to do counselling, it's really important to create that support for your body, your physical body, and move those elements along so that the body can heal. And I think, in essence, if you are doing these things while you're doing counselling, you are going to actually get more out of your counselling. You're going to move through the stages that they're probably working you through, and a lot quicker, and you will actually have less reaction to reliving it. And also, most importantly, is that when you end your counselling session for that week or for that fortnight, whatever it is, you go away and you feel good. Sometimes counselling can actually stir up a few things, and sometimes people can actually leave feeling a little bit more distressed than when they went in. So that's where Chinese medicine really is quite supportive in that process. And I would probably recommend that Chinese herbal medicine and acupuncture is the best way. I've seen with many patients, especially when we're working from qi and blockages, loosening the pericardium, all these sort of things. When you're working from that perspective, acupuncture is really phenomenal for it. It's really, really effective. So I would really encourage anyone who has been traumatized, not knowing what to do, to look into what the acupuncture can do for you individually, and working through that. And the other thing is to be aware of is emotional traumas, whether they're your own or those passed on. There's layers, there's various layers that need to be shared, and different things will come up. So as you get healthier and stronger, other things present, and it's very important to communicate this with your practitioner, because then they will know how to help you with your situation, and whatever comes up. Like I said, we look at various signs to identify where weaknesses are. So we need to know how you're feeling during treatment, how you're feeling after treatment, and also how you're feeling between treatments, because all this process of unraveling and moving qi and clearing pathogens and promoting circulation is all part of the healing process. So anything that presents, we need to know about it. So hopefully that's been a great insight for you into emotional traumas. This is something that I'm quite passionate about, because I see a lot of this in my clinic, from the perspective of chronic illness creating a trauma, a lot of abuse, child abuse, also relationships, or even just challenging times in people's lives, and kind of down the ladder is the genetic aspect. Obviously, there's a huge impact to babies when they're in utero, and if mum is feeling tense or anxious, that's going to transpire into the baby too. So I do see a little bit of that too, but it's something that can be dealt with. I think people think they need to just get over it, and like with anything, you can't just get over it. It's like me saying to someone, well, just get over your headache. People don't say that to others that are affected by a headache, or affected by sinusitis, or affected by arthritis. They don't just say to them, get over it. But when it comes to emotions, people feel that those affected can just simply get over it. Just stop being depressed, stop feeling anxious. You're creating it. And it's not. It's the body creating it. When there are weaknesses in various organ systems, these emotions present. If your liver's not happy, you're going to feel depressed. You're going to feel irritable. You're going to feel angry. You're going to feel like you can't cope. You're going to feel overwhelmed. If your stomach is affected, you're going to be overthinking and be a worrier, and that's going to make it worse. When your heart's affected, you're going to feel anxiety. When your kidney's affected, you're going to be fearful and afraid. So don't feel that you simply can switch off this emotion when it's just another symptom the body is presenting. Just as a headache, just as acne, these are the symptoms that manifest when there's an imbalance in the body. And so when there's an imbalance, the good thing is that Chinese medicine has great resources to clear that imbalance and help you along your way. So if you have any questions, please email me or give me a call. You can email me. Probably email is better, because obviously when I'm with patients, I can't necessarily talk, but email is always a great way where I respond fairly quickly. info@salubre.com.au. And I would love to hear from anyone who is either going through this or trying to deal with it, or know of someone who's dealing with it and they don't necessarily know how to support them. That's another thing, when you're seeing someone else go through it, how do you support them through that process, which can be quite challenging. So reach out, let us know how you're going and what has worked or where you're at, and really provide that openness around this topic where people will talk freely about it and not have it as such a shameful, hidden part of their life that really shouldn't be, because it's not anyone's fault if you've been traumatized, except for the people that have traumatized you, of course. So yeah, share how you've dealt with it, or what you're doing, or what you need. And I'd be interested to know what has worked for you, if you've found anything that works. And that's about it. A nice quick podcast today. I think sometimes you know, sharing these little gems, as I call them, gets that thought, the mind working and thinking beyond what else you can do to empower your situation and take control of your health, and to learn from the circumstances that you've been put into. So hopefully you find this interesting and informative, and I'd love to hear from you. So stay tuned for future episodes. We're covering various elements of health. You know, when it comes to the human body, there's so many aspects that affect our health. So we'll be covering a wide variety. But if there's something that I haven't covered, you know, drop me an email and let me know. I can certainly do that and help you with whatever challenges you're facing. But for now, I'll see you next time, and hopefully you have a great day. Bye for now.